Meet Paul. This is Paul. Paul is 70 years old and lives with his wife. Paul relies on home care services for bathing and housekeeping. He is also recently diagnosed with dementia and Parkinson's disease, urinary retention, and chronic constipation. Due to his worsening condition, the care staff recommends Paul to attend dementia daycare for rehabilitation and home nursing service for his urinary catheter care and constipation management. Jane, a care staff from dementia daycare, wants to provide holistic care, but faces challenges sieving through Paul's health records and past assessments. And Paul is frustrated from sharing his story repeatedly to multiple different care staffs. This is where interRAI can help. interRAI is a suite of globally recognized standardized assessments, backed by extensive research and used in over 35 countries around the world. interRAI is a comprehensive assessment tool that is able to evaluate an individual holistically across function, health, mood, behavior, social support, and environmental aspects. As a person-centered tool, it enables customized care planning to address individuals' needs effectively. In Singapore, interRAI will be used for care assessment and care planning in nursing homes, center-based care, and home-based care. interRAI will streamline many assessments done today into one common assessment. Core data set from one interRAI assessment is also able to carry over and inform on the next assessment, thereby reducing assessment burden on both providers and clients. Now let's take a look at how interRAI can help Jane care for Paul. As Jane creates a new assessment, she is able to retrieve Paul's past assessment. Instead of filling up the entire full assessment again, she can pull over the previous assessment to auto-populate the current one. This will reduce data entry burden for Jane, allowing her to spend more time caring for Paul. interRAI's built-in algorithms will generate scales and clinical assessment protocols, also known as CAPs, which highlight areas where Paul may be at risk of decline and show potential for improvement. interRAI provides decision support for Jane to prioritize Paul's care needs in her care planning. interRAI's care plan page comes with a care plan library consisting of suggested interventions for each of Paul's care needs. This makes it easier for Jane to develop an individualized care plan. With interRAI, Jane can also conduct longitudinal tracking and monitor Paul's progress over time, quickly identifying improvements or areas that need adjustment, which facilitates timely interventions and continuous quality care. Paul's interRAI assessment indicates that he requires urinary catheter care and constipation management by a home nursing provider. Jane and the home nursing provider can now access one common interRAI assessment and care plan to ensure continuity of care for Paul. Standardized interRAI training ensures a shared understanding of identified issues, enabling consistent evaluations and streamlined communication for coordinated, person-centered care between Jane and Paul's home nursing provider. Making assessments easier, auto-generating care outcomes to help with personalized care planning, interRAI empowers care staff like Jane to spend less time on paperwork and focus more on providing good care. interRAI, enhancing care.